Cefazolin is a type of antibiotic that is used to treat many different kinds of bacterial infections. It can also be used before and during certain surgeries to help prevent infections. This medication is known as a cephalosporin antibiotic, and it works by stopping the growth of bacteria. It is important to take this medication exactly as prescribed by your doctor. The dosage and timing of taking this medication will depend on your specific medical condition and response to treatment. Be sure to follow your doctor's instructions carefully for the best results. When using cefazolin sodium vial with threaded port, it is important to follow the instructions given by your doctor. The dosage will depend on your medical condition and response to treatment, and for children, it will also be based on their weight. If you are administering this medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using it, check the product visually for any particles or discoloration. If you notice either of these, do not use the liquid. It's also important to learn how to store and discard medical supplies safely. For the best results, use this antibiotic at evenly spaced times and try to take it at the same times every day to help you remember. It's crucial to continue using this medication until the full prescribed treatment period is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition persists or worsens, it's important to inform your doctor. Some common side effects of using cefazolin sodium vial with threaded port may include swelling, redness, pain, or soreness at the injection site, as well as loss of appetite, nausea, vomiting, diarrhea, or headache. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects, but it's important to contact your doctor immediately if you experience dark urine, easy bruising or bleeding, fast or irregular heartbeat, seizures, weakness, yellowing of the eyes or skin, or mental/mood changes. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you develop persistent diarrhea, abdominal pain, or blood/mucus in your stool, it's important to seek medical attention. It's also important to avoid using anti-diarrhea or opioid products, as they may worsen symptoms. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. If you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms, it's important to contact your doctor. While very rare, a serious allergic reaction to this drug may occur. Seek medical help immediately if you experience symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, it's important to contact your doctor or pharmacist. Remember, it's always important to consult your healthcare provider if you have any concerns or experience any unusual symptoms while taking this medication. Before using cefazolin, it's important to let your doctor or pharmacist know if you have any allergies to cephalosporins, penicillins, or any other substances. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's best to discuss this with your pharmacist. You should also inform your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, or stomach/intestinal diseases such as colitis. It's important to note that cefazolin may affect the effectiveness of live bacterial vaccines, such as the typhoid vaccine. Make sure to inform your healthcare professional that you are using cefazolin before getting any immunizations or vaccinations. Before undergoing surgery, it's important to let your doctor or dentist know about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to inform your doctor before using this medication. Additionally, cefazolin can pass into breast milk, so it's best to consult your doctor before breastfeeding while using this medication. It's important to be aware that cefazolin sodium vial with threaded port may interact with other medications, potentially affecting how they work and increasing the risk of serious side effects. It's crucial to keep a record of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, it's important to note that this medication may interfere with certain lab tests, such as the Coombs test and certain urine glucose tests, potentially leading to false test results. It's essential to ensure that the lab personnel and all your doctors are aware that you are using this drug. If you or someone you know has taken too much cefazolin sodium and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Signs of an overdose may include trouble breathing and seizures. Always take medication as directed and seek help immediately if you suspect an overdose. It's important not to share this medication with others. This medication has been prescribed specifically for your current condition, so it's not recommended to use it later for another infection unless instructed by your doctor. During the use of this product, you may need to undergo lab or medical tests such as complete blood count or kidney function. Make sure to attend all medical and lab appointments and consult your doctor for more details. Remember, it's crucial to take this medication exactly as prescribed. If you happen to miss a dose, make sure to consult your doctor or pharmacist to determine the best course of action. Avoid doubling up on doses to make up for a missed one. As for the optimal timing of taking this medication, be sure to follow your doctor's instructions. Be sure to consult the product instructions and your pharmacist for storage details. It's important to keep all medications out of reach of children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. It's essential to properly discard this product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.